Hey guys, Dr. Nizam. I am here and excited to talk to you guys about preservation rhinoplasty, something that has become very near and dear to my heart. This is a technique that has been really popularized over in the European countries and it's coming to America. I'm definitely a person who has totally bought into this. About 2 years ago, I changed my technique from what's called classical structural rhinoplasty to this, and I really haven't looked back. My first intentions were to do this for specific cases, but now that I've used it, I just really think that it is a better technique and my results have gotten better and better as a result. So what is it? So basically we are preserving the top of the nose. That means when you compare to a classical technique where we would go and we'd cut the top of the nose off, with this we're actually pushing the nose back into the face. In that video I put up, you're going to kind of see how this works. Hopefully it makes a little bit more sense because sometimes it's confusing when we just talk about this stuff. Now it's all done through incisions inside the nose, which is really cool. There's no incision down on the columella, so all hidden incisions. And we preserve a lot of the ligaments around the tip of the nose. The other cool advantage of that is you get less tip swelling, and that tip swelling goes away quicker. Additionally, you get more tip definition in the end because you haven't taken those ligaments apart. Now, why I think it's so much better is because we haven't taken apart the top of the nose. And when we try to reconstruct anything in the body, it's very difficult sometimes to get a natural look. Sometimes it looks great, but sometimes it looks a little bit off because that's just not what you were born with. So if we can simply modify things without having to take them apart, it can give a much more natural result. You also get faster healing. So I've noticed with this, my recovery times have gone down significantly. First time when that splint comes off at about day 7, you're usually looking pretty good. Yes, there's a little bit of swelling, but I'm actually seeing I don't get a lot of bruising. People are able to go out into social events within 10 to 14 days and people don't even know they've had surgery. So it's a much nicer technique for the recovery as well, used in my hands. Even though it is a great technique, occasionally some people do need revisions, and God forbid you're that one person. It is an easier technique to revise because you haven't surgically altered everything. So there's a lot of advantages to it. I just think it's one of those things that will catch on with time more. And I just have been so happy with our results doing. I'm going to put some of those results up so you can see just kind of how natural they really look. And everyone gets a little bit different result in my hands. My big thing is I try not to make every single nose look the same. I try to do combining what you want, kind of what your goal is, and making sure that that balances with your face, because everyone has a different face, and even your personality. Like, this is a lot of all this needs to match together. Well, how do we do that? So even if you're a virtual consultation, we'll have a talk virtually, we'll go over your goals, and we'll kind of come up with a plan, and I'll talk to you about my plan. That all may not make a ton of sense until you see some 3D morphing pictures. So we have a 3D camera, and even if you're out of town, the day before surgery, you come in and we morph those pictures and we make sure our goals kind of align and that we're kind of have the same vision. Once we kind of agree upon that, I'll put that up in the operating room while I'm doing surgery, and usually I can get within about 20% of that picture, which is really cool because now we both kind of have met our expectations and people end up very happy with this procedure. Pain is very minimal as far as recovery. People will take pain meds for a day or two, and usually that's it. You wear a splint for about a week. If you're out of town, I usually keep you for about 6 to 7 days here just to take the splint off and make sure you're doing well. And then you're on your way. And we can do the rest of the follow-ups virtually, or if you're in town, we can do them in person as well. So really nice procedure. If you're interested in learning more, having a consultation with us, give us a call. I'll put that number up on the screen, or also you can send an email. I will also put that up so you can send that. And I look forward to talking with you.